video for the SwiMobility series is going to be kind of lower extremity based. You don't see too many injuries really with the swimming community or swimming population in your legs, but what I do see a lot, if it is a lower extremity injury with a swimmer, is kind of hip flexor related injuries, and a lot of that is for breaststrokers. Across the board, any stroke, you do use your hip flexors quite a bit because you're just constantly kicking and getting that minute hip flexion here. But breaststrokers is really when you see that forced hip flexion, and that can be kind of an overuse injury in and of itself. So first thing we want to focus on is hip flexor group, keeping that nice and loose. Easy thing to do, foam roller, like always, we're starting out. A lot of you guys have one of these at home, so your IT band kind of attaches into a couple muscles here. Your TFL, your tensor fasciae latae right here, acts as one of your a main hip flexor, and then also your glute max. So you see a lot of kind of knee problems stemming from issues with the IT band, but a lot of it really starts at the hip flexor level and where the IT band kind of attaches. So we're going to try to keep that loose. So here, pretty easy. I want you to focus on kind of right by your pocket. Actually, is a good way to kind of find that muscle. It's not all the way on your side, and it's not all the way on your front. They're right where you would be putting your keys in the morning. Foam roll that TFL pretty well. If you find a really kind of tight spot, you can bend your knee up, get a little bit of stretch on that tissue there by moving the IT band from the knee. Same thing, glute max, big butt muscle, roll that guy out. And after you're done rolling out hip flexors and everything, you can kind of complement that with a little bit of a stretch now that you've got some good blood flow in there. Half kneeling, just here, leaning forward. Something that I don't want you to do is arch through your back when you're doing this. So I don't want you here, but I do want you to push your hips forward. So here you should feel a good stretch. You'll notice a big difference with this based on where your foot is. So if my foot is straight behind me, totally lined up, that's fine. Breaststrokers, anyone can do this, but breaststrokers especially, I want you to move your foot out so your leg is a little bit in that internal rotation for that. You got to get that internal rotation of your hip to really start off your kick. So this is a great spot. You'll feel it really, really isolated right there in your hip flexor and your TFL with that internal rotation component. Something that if you have a heavy band, it's a great complement to that stretch. We're essentially doing the same thing, but now we just got a band pulling a little bit harder. So here, same idea, pushing forward, and that band's just pulling my femur forward, really kind of exaggerating that stretch. Any of these stretches, I want you kind of holding it for at least a minute. That's when you really see the most amount of change in at the tissue level. And again, moving kind of out into that external or that internal rotation position behind you. Another good thing with the foam roller, swimming is very quad focused. Everything's just focused on that knee extension component. So if you are using it to kind of roll out your legs, here, especially down here at your IT band, just like we did with the shoulder video, if you find that spot of tenderness, I want you to just park the foam roller in that spot and just bend the knee 5-10 times. Really try to cause some shear force on that muscle. You'll notice really good, acute range of motion improvements with this kind of stuff. You can do this anywhere you want. So with swimming, it's not necessarily, you need to have strong legs obviously, but kicking and the fastest kickers actually have the most amount of plantar flexion. So pointing your foot down this way. So if you have more plantar flexion and can get your foot as flat as possible, you're moving the most amount of water. So that's a really important thing that I have really never seen anyone work on. So we'll kind of focus on that first. Again, we've got a peanut. So two lacrosse balls taped together. And you're gonna focus on kind of your shin muscle here, your anterior tib. It's responsible for that dorsiflexion movement here. So if that's tight, it's gonna limit your plantar flexion motion here. So we're gonna kind of mobilize that tissue with the peanut. Pretty easy. You kind of put your body weight into it. Spend 40 seconds to a minute, really kind of roll that tissue out. And then you can kind of complement that with a little plantar flexion stretch, and the easiest way to do that, sitting here, kind of rocking back. So again, plantar flexion is super important for swimmers. That's how you really get the most effective kick. But the problem with doing too much of this is you can kind of cause some ankle instability, which for everyday life other than swimming is not a great thing and can lead to other injuries down the line. So with all this stuff, I kind of want you working on some ankle stability drills that are good for that. Anything single leg, getting you moving across your body, standing on a foam pad, anything like that. So work on that plantar flexion mobility, but be aware that it does kind of create these other issues that you need to be aware of. So that's it for the lower extremity.